Over the last 2 weeks, the wrongful deaths of George Floyd, Ahmaud Arbery, and Breonna Taylor have been weighing heavy on my mind. As a white cisgender female, it's impossible for me to ignore my privilege. The same privilege that's allowed me to say that I'm not racist and for that to be acceptable in our society. So over the past week, I've muted myself on social media. I recognize that I have a very limited perspective on what's happening for Black and people of color in North America. And in muting myself, I really took that time to observe and to listen and to learn from everything that was being posted online and talked about in the news, and to develop my own opinions in a humble way. This is by no means finished. This is just a starting point. But I started asking myself, if I'm not going to be racist, if it's not enough to not be racist, and instead we need to make a commitment to being anti-racist, how do I share that with my viewers on this platform? So today I've decided in this video to use the privilege that I have and to speak about that privilege and how it impacts psychology and the field of therapy, and to share a bit of a discussion on the disparities that face people of color in North America when they're seeking out therapy. I'm Meredith Mackenzie, and I'm a registered clinical counselor and owner of Parallel Wellness in Burnaby and North Vancouver, British Columbia. On this channel, we explore topics that bring clients to our therapy practice every day. We provide tips and strategies that you can make your own to enhance your everyday life and manage your mental wellness. So I want to start this video by naming my privilege. For one, I'm highly educated. I'm incredibly grateful, and I recognize how amazing it is that I've had the opportunity to pursue my doctorate degree at the University of British Columbia. That's not an opportunity that everybody gets, and it's especially more difficult for people of color to be accepted into these programs and to pursue degrees like this for various reasons. And because of this privilege, I have access to a wide library of peer-reviewed journals and articles where I can learn more. And while this information is considered less biased than what you might read in the newspaper, I do also have to acknowledge that there's an inherent bias in any type of research just by looking at the people that are conducting this research. In North America, the majority of academic positions are held by white people. And while these researchers may have the best of intentions when they're conducting their research, it is impossible for them to share the same experiences as a person of color. Because of this difference in perspective, they may not be asking the same questions that people of color would be asking in their research. They may see things from a different slant. They may interpret their data in a different way and come to different conclusions with their research. And that's just one area of psychology that is impacted by race disparities. In conducting research, this might also impact the responses that they receive from participants. It may impact who decides to participate in research, as well as how forthcoming participants are in their responses. So when we look at the research that exists, it's very likely that the research does not accurately represent all people within North America. And in today's video, I want to focus on therapy and how race disparities may impact people of color. I found a really great article online by Arti Patel from Global News, and in this article she explores the experiences of people of color seeking out therapy and how these experiences demonstrate the disparities between the experience of seeking therapy for someone who is white or of the dominant culture and somebody who is a person of color. In this article, she interviewed people who were interested in seeking counseling, who wanted to be able to find a therapist who understood them and someone that could help work through some of the challenges that they were experiencing in their personal lives. An error I believe that white folks have made for quite a while is that in their attempts to be not racist and to have compassion and understanding for people of color is that they've gone about it in a way where they want to say, I don't see any color. We're all the same. We're all equal. I'm not a color. You're not a color. We're equally the same. And the reality is that's not true. Regardless of somebody's race, regardless of the color of somebody's skin, culture plays a big role in all of our lives. Whether that's the culture of the family that you grew up in and just, your family culture, or your more extended ethnic culture, where it really impacts people of color is recognizing that people of different cultures, specifically ethnic cultures, have different life experiences. There's different language that they use about their emotions and their thoughts. There's different ways that they talk about mental health issues. And there's also different levels of comfort in talking about these things. In some cultures, it's not appropriate to talk about what's going on in your family life. That's something that's private and to be kept within your household. And in other cultures, finding the words to express your emotions can be difficult if that's not a part of your culture. So Arti Patel points out in this article that the match between client and therapist is so important. And that doesn't necessarily mean that they need to be of the same ethnic background or race, but when there is this possibility, when a client is able to meet somebody that they believe has a shared experience or can really understand them because of this shared experience, that goes a really long way in building rapport and helping clients to feel they're understood, that what they're saying makes sense, and that it's normal. And that can be one of the hardest parts of wanting to attend therapy for the first time, wondering, is this going to be received well? Am I going to feel heard? Is this going to be helpful? And Arti Patel points out in her article that when people of color seek out therapy and they aren't met with somebody who has a shared lived experience, and there are substantial differences in lived experience, it can actually lead people of color to feel even more isolated, even more alone and misunderstood, leading them to not want to seek therapy, which dealing with mental health challenges or any kind of social challenges can feel incredibly difficult already, and this just adds another layer to the situation. Now, even beyond the matching of therapists and clients based on their ethnic background, people of color are more likely to face many of the hurdles that prevent people from seeking out counseling. Number one is the cost of therapy. Unfortunately, in the United States and Canada, the majority of therapeutic services are not funded by the government. In Canada, while we do have universal health care, therapy services are not included in that. So clients are often expected to pay an hourly rate that is often out of their budget. And while there are services who offer low fee or free services for counseling or therapy, these programs often have long wait lists, and it's not always guaranteed that a client will be able to be matched with somebody of their same race or ethnicity. An additional barrier that Arti Patel points out is that people of color may speak a different language. English may not be their first language. So when seeking a therapist, that can be incredibly challenging to find a therapist who also speaks their first language. And even if the person were able to speak English with their therapist, when you're speaking a second language, you don't necessarily have the same access to the vocabulary that you would like to be able to use to be able to make therapy effective. Now, taking these disparities one step further and looking at the actual therapists that are providing therapy, the race disparities continue. The American Psychological Association conducted a study in 2015, and they found that 85% of all psychologists in the United States were white. 5% identified as Asian, 5% identified as Hispanic, and only 4% identified as Black or African American. And these percentages are significantly lower than the general population differences in the United States, where there's a 62% population of white folks and a 38% race or ethnic minority in the United States. Now, specifically in the health services psychology field, which would be therapists and psychologists, psychometrists, the people that are working directly with clients, 88% of the professionals in this field are Caucasian, and only 12% are racial or ethnic minorities. That is less than 30% of the race or ethnic minority population in the United States. So when we think of people of color who are interested in seeking out therapy and their likelihood of finding a therapist who not only matches their race or their ethnic identification, imagine then also trying to find a therapist who matches you just on a personality level, because that's a big part of finding a therapist who works for you. And then on top of that, imagine trying to find someone who also speaks your first language. To top it off, training programs for psychology, counseling, therapy have all been created by the dominant white culture. This means that even if a therapist of color does enter one of these programs for training, the information that they're learning and being indoctrinated with all comes from a Caucasian perspective of mental health, functioning, assessment, understanding other people. And how does that not lead to an inherent bias for any therapist who attends that program? If we look at the dominant treatment modalities that are out there right now that are used in the majority of our hospitals and clinics and private practices, CBT, DBT, person-centered therapy, narrative therapy, emotion-focused therapy, all of these therapy types have been created by white professionals and academics, which means that these therapy modalities may not represent or work well for all individuals within North America. And as I finish this video, I want to say I am definitely not an expert on race and race disparities. I am still a learner. I am somebody who is sitting here and trying to use my privilege in the best way that I possibly can to speak out, to learn more, to take this time to educate myself on how race disparities impact therapy and the training of therapists. That's where I'm starting today. So if you have any comments or questions, please leave them in the comment section down below. I will try to answer them the best I can, and also maybe direct you to some research information that I've been looking at myself. I've also left links in the description box down below for a number of therapists within the Vancouver area who I trust and can attest to the quality of their work. And all of these therapists are people of color, and I've included links to their websites just to take away one of the barriers that people might have when seeking out therapy from a person of color. Thank you for watching this video and for giving me this opportunity to challenge myself. I want my viewers to know that this is just the first step in my education to become an anti-racism ally. I'll see you in the next video on Wednesday.